today I'll be starting this talk show with a brief introduction on all the drugs that we might come across in our daily ophthalmic practice. So these drugs can be broadly classified into two distinct groups. They can be diagnostic or drugs which are used for investigative purposes, and therapeutic drugs or drugs which are given for treating a particular condition. So examples would be of diagnostic drugs would be of fluorescein strips. Therapeutic drugs would include antibiotics. Now, before we jump into drugs, we have to understand this particular topic. That is the pharmaceutical nomenclature or the naming of drugs. Now, each drug has a chemical name or the drug name and a brand name which is given to them by a particular pharmaceutical company. Look at this drug. So the chemical name is olopatadine, whereas the brand name is Ologic. And again, a similar chemical name, olopatadine, but a different drug name, brand name, which is Patvera. So we have to take this into account, and we have to know the chemical name of each drug and not just the brand name. So what are these common drugs that we might come across? We'll start with drugs which are used for investigative purposes, like stains, fluorescein stain. Now these are used on the corneal epithelium, sometimes on the retina to look for blood vessels, new blood vessels. Here's an example. Next, we have rose Bengal stain, which is used on the conjunctiva. Again, it helps tell us about epithelial defects. Next, we have lissamine green stain, which gives a clear understanding of any conjunctival tear or problems on the conjunctiva. And indocyanine green. We are familiar with this because this is used for fluorescein fundus angiogram, and a picture like this is obtained. Now, what are the drugs that we use against infection? Now, these can be classified into antibacterial, antiviral, and antifungal. Antibacterial drugs, so used against bacterial infections. Some examples would be tobramycin, gatafloxacin. These are antibiotics. Next, we have drugs used against viral lesions like viral conjunctivitis, herpes zoster ophthalmicus. Here, I have a photo of a condition called herpes zoster ophthalmicus, for which we can use aciclovir eye ointment. Antifungal. Now, we are very familiar with this. Fungal corneal ulcers, especially in countries like India, where we use drugs like natamycin and fluconazole. Now, moving on to the next group, we have anti-inflammatory agents. So these anti-inflammatory agents can be classified into either synthetic steroids or non-steroidal anti-inflammatory drugs. Let's look at both. Steroids. Now, this reduces the inflammation. It is used in post-operative patients, viral infections, chemical burns, and uveitis. Examples would include dexamethasone, fluoromethalone. Now, NSAIDs or non-steroidal anti-inflammatory drugs reduces pain. It can also be given in post-operative period, and most importantly, reduces inflammation in certain conditions like central serous retinopathy. Examples would include nepafenac and flurbiprofen. Now, let's move on to a very important group of drugs, the anti-glaucoma drugs. In order to understand how they are used, we have to understand how they operate on the eye. So there are three mechanisms by which these group of drugs can act. Number one, they can decrease aqueous production. Number two, increase the facility of outflow, or rather it increases outflow of aqueous. And number three, it reduces intraocular osmotic fluid. Let's see each method. Number one, decreases aqueous production. This includes beta blockers like timolol, betoxolol, alpha-2 agonists like brimonidine, carbonic anhydrase inhibitors like dorzolamide, brinzolamide, and tablets like acetazolamide. Number two, increases aqueous outflow. And this we have prostaglandin analogs like latanoprost. And intraocular osmotic fluid reduction, which can be achieved by giving IV 20% mannitol. Let us move on to a newer group of drugs that we use called the anti-vascular endothelial growth factor. What is vascular endothelial growth factor? It plays a crucial role in the formation of new blood vessels. which is the main pathology behind diseases like proliferative diabetic retinopathy, tumor angiogenesis. Basically, that means there are new blood vessels in tumors, macular edema, and neovascular age-related macular degeneration. Now, an example of this drug is bevacizumab. These are the indications: neovascular age-related macular degeneration, proliferative diabetic retinopathy, diabetic macular edema, retinal vein occlusions, neovascular glaucoma, and retinopathy of prematurity. And all of these diseases, their main pathology happens to be new blood vessel formation. Now, we have seen various groups of drugs. How are these produced, or rather, how are they obtained in the pharmacy? Now, we have different types of solutions which are given as clear liquid form, such as lubricants. We have suspensions, which sometimes are given as a powder and liquid and have to be mixed in order to obtain a liquid form. They can be cloudy or milky. And the reason we give suspensions is because they have better penetration into the anterior chamber. An example would include napafinac or gatifloxacin in a steroid combination. Next, we have ointments. Now, these are oil-based liniments which melt and get absorbed into the tissues. And the reason we use some drugs as ointments is because they have prolonged drug delivery mechanisms. An example would include chloramphenicol and polymyxin B combination for infections. Thank you. And this concludes my talk. I hope I was clear. Any questions will be dealt at the end of this talk show. Thank you.